the culture at Weill Cornell is great. I think it's been really friendly. Everyone is motivated and works really hard. And I think there's great collaboration between the medical staff and the fact that patients seem to just be really satisfied with their patient care. Rehabilitation medicine is about getting people to their functional goals. That can mean different things for different people. So for someone that might mean going back to running so that they can run a marathon. Someone else might just want to be able to play with their grandchildren and not have back pain. So I think the goal of rehabilitation medicine is really the patient's goal, which is getting them back to doing whatever it is they want to do. As physiatrists, we're trained to look at the whole person and utilize as holistic of an approach as possible. So we're not just trying to identify what brings you in here today, but really what do you do as a person that might be contributing to your current symptoms. I want to know not only what's causing your pain, but what do you do day to day? What are your hobbies? How are you sitting? How are you spending your time? I think all of those little things can have a big impact on what brings you in to come see me. And I think unless I understand all those things, I don't think I can design the best rehab plan. Pain is a big part of what I do. It's hard to get better and it's hard to get stronger if you're in pain. In addition to that, I do think that your affective components, so your mood, your fear, that can have an impact on your recovery. If patients are experiencing any of those things, it's helpful to bring it up and discuss it openly and figure out what we can do to alleviate that. I rely pretty heavily on diagnostic imaging to identify the potential pathology that's going on. So that might include X-ray and MRI. I also perform my own diagnostic ultrasound in the office that can give a lot of good information about any soft tissue pathology. Physical therapy and just therapeutic exercise in general is the cornerstone of my approach to patient care. I genuinely believe that exercise is medicine, and I think that it's one of the best medicines that we can prescribe if done effectively. So a big component of rehabilitation, I think, is designing a well thought out and thorough physical therapy plan. And that's something that I love doing.